Together with me in the studio today, I have Anders Carlson from Idogen. Good morning, Anders.
Good morning, Klaus.
And what is it briefly that Idogen does? Please tell me that.
We are developing a cell therapy named tollogenic cell therapy that is with the aim of treating severe diseases and conditions when the immune system has become the enemy of the patient.
Very interesting, very interesting. Anders, please tell me a little about your background, because you have a very interesting background.
I have a traditional, you can say, in the beginning, pharma background. I spent 15 to 20 years in Novartis, a global big pharma company with a broad range of therapeutic areas. Made a traditional career starting with sales, marketing, and was actually in the end the managing director of Novartis Norway. Before I decided to step into smaller companies and also small public companies. And I have a history of being CEO of Allenex, a company listed on the Swedish Nasdaq stock market, small cap, a company I was working in for first 5 years as a CEO. And then we also sold the company to a US-based Nasdaq-listed transplantation company called CareDx based in San Francisco, where my role was to take the responsibility of the business outside the US and the rest of the world for 2.5 years. And now I'm here in Idogen since 2 years back. A very exciting company with a lot of opportunities in a new area of treatment of patients with severe diseases, which I believe a lot in, and that's the reason why I have entered the company 2 years ago.
Yeah. So Anders, and that's very interesting. Can you please explain for the viewers what pipeline are we going to see for the next 6 months? What is the most important trigger we should watch out for the next 6 months in terms of your pipeline?
The last 2.5 years has been very busy within the company. We have improved the key component in the treatment, the cell therapy, and we have also applied for a new patent, which will allow us for 20 years market exclusivity if approved. So that will lead us to 2040 actually. But since these 2 years has passed, we have also done a lot in development of the product, and now we are very close to move into a preclinical into clinical stage. First indication is hemophilia A, a bleeding disorder, and these patients are today treated with a factor 8 treatment, that is a clotting factor. And around 30% of these patients develops antibodies towards the treatment, which takes away the efficacy of the treatment. And by using our treatment, you actually can take away the effect of these neutralizing antibodies and be able to continue with this original treatment with factor 8. So this, if it works, would be a breakthrough in the treatment of these patients. And we start the clinical trial, if everything goes as it should, at the end of this year, and we are now applying in the end of the summer for getting the permission to start. So this, I think, is the main trigger in the near time, that's to start and to get the study approved.